Hi, my name is Brad Skeels, and I've been dealing with an enlarged prostate for more than 20 years. Up till now in 2017, it became really more problematic. I had kidney stones, and after that procedure, my wife and I decided that there's just something had to be done. All the other procedures that we had looked at were a lot too invasive and a lot of side effects and a lot of problems along with them.
BPH stands for benign prostatic hyperplasia. It's a condition that causes the prostate to get larger as a man gets older. The typical symptoms include a decreased urine stream, getting up at night several times to empty the bladder, a sensation of not being able to empty the bladder completely, as well as hesitancy or straining to try to get the bladder empty.
We went into Dr. Walker's office after finding him on the internet, and the minute I met Dr. Walker and his staff, I felt completely comfortable. I felt relaxed. I was able to speak about things freely. I didn't feel inhibited at all.
Typically, if a man goes to his doctor with complaints of urinary difficulties with an enlarged prostate, he'll be started on one of two medications, one that either relaxes the muscle tone of the prostate muscle tissue or one that shrinks the gland down in size. And both of those medications can have some definite benefit, but they have limitations in how much they can do, and they can typically cause some side effects related to sexual function and even affect blood pressure or nasal congestion.
It's been quite the experience for me. 20 years of prostate issues, watching my husband have infections and wake up 20 times a night, the urgency, the pain, stopping on the side of the freeway because he can't wait till we can find a place. Just whatever my husband has gone through, it's been really a difficult journey for the both of us for many, many years.
Most men who have tried medication and determined that it's either not working or they have undesirable side effects will be offered a surgical procedure, which usually involves cutting of tissue or thermal heating of tissue, and they'll typically have some concerns about side effects. There may be some prolonged recovery from those more invasive procedures. So when the Urolift came about, it was found to be a procedure that didn't require any cutting or removal of tissue and could be performed in a minimally invasive setting with no real side effects, and quick improvement in symptoms and quick return to normal activity.
Dr. Walker introduced me to the Urolift procedure and had very little, if any, side effects whatsoever. It was non-invasive, and it was something that could be done locally in the office without putting you to sleep or any really inconvenience to you whatsoever.
Well, when I evaluated Mr. Skeels, he'd already been on medication therapy for several years and obviously was not getting very good results with that. We had discussed some other treatments that were a little more invasive, such as the laser TURP and the TURP procedure. He was hesitant to undergo something more aggressive, and I thought he would be a great candidate for the Urolift procedure. Benefit is that he would be able to leave the office without a catheter, and that was a big plus for him. He had a catheter in previously after he had gone into urinary retention and really didn't want to have the catheter again. So this was definitely a bonus in regards to the Urolift procedure.
When he got started, I didn't feel any discomfort whatsoever. There was a little bit of pressure, and that was about it. It seemed like it was just a very slow, methodical procedure, and I never felt pain. I never felt uncomfortable. I never said, "Hey, you need to stop," or it was just very smooth, very easy, very simple.
They helped my husband get comfortable, did a little bit of ultrasound, got us set up for the procedure. He allowed me to be in the room with Brad, so that was really nice. And then we walked out of there, literally walked out of there, which was kind of amazing for both of us.
So after the procedure was over, I just took my wife by the hand and walked out of the doctor's office, thanked them for everything, and went home and started back about our normal activities. The very first night I slept most of the night, got up one time to go to the restroom. The next day I decided to go play some golf, so I went out to the driving range and hit a few balls, and I actually started to play the game, and I didn't have the urge to go to the bathroom at all.
Over the years, we've talked about many procedures, things that we can do to try to help, and all of them had side effects and scary things that we did not want to negotiate. So when the Urolift procedure became available, it seemed like the right option for us, and we're wishing we did it much, much earlier, because it really has changed our life.